I think it comes down to this. We shouldn't just be talking about, oh, Eric, you really need to trust me. I'm charming and I know how to talk. It's about being self-reflexive and say, what makes me trustworthy? And if you're working in a health system, what actions are we taking that makes me trustworthy? And we should do this in our personal lives as well. So thinking about trustworthiness instead of asking people to trust us is, I think, a key to a deeper listening and hearing each other.
The big social media platforms have all but abandoned content moderation, and the new AI services don't even try and hide the fact that a lot of the answers they're generating contain hallucinations with stuff that's just made up. Sure, for a lot of the news we consume, it doesn't really matter that much. But that's not the case when it comes to health information. Today, on Conversation Changers, I'm thrilled to be joined by one of the world's foremost experts in health communication. Tina Purnat is a Salzburg Global Fellow and a visiting scholar at the University of Memphis School of Public Health and a Doctor of Public Health candidate at Harvard University School of Public Health. Prior to that, she spent almost 15 years working on health information issues at the World Health Organization. Tina joins us today from Boston. Welcome to Conversation Changers.
Hi, Eric. It's nice to be here.
Tina, it's great to have you here. This is such a timely topic, especially with what we're seeing unfold in the United States. But certainly the United States is not unique in having these challenges of bad health information making its way into public policy. And what we're seeing in the US and many countries, even in Europe and elsewhere, is really a deficit of trust. A lot of people have become very cynical about anything related to health. There's a lot of mistrust of vaccines and whether they work. People don't trust the pharmaceutical industry because they think they're just trying to be exploitative and make money. In some countries, the insurance companies are enemy number one. More and more, good science and good public health policy are just being pushed aside, and people with ideological and political agendas are making room for their thoughts on these issues. You've been in this space for a long time now. How would you describe the state of trust that people have when it comes to health and medical information? Let's start our conversation there.
Absolutely. People's journey with health information actually starts way before they come to see the doctor. We see now quite a lot that people search for health information before they come see a nurse or a doctor, and they actually check afterwards the recommendations that they received, the medications that they received, right? So the doctor isn't now the authoritative figure in a person's health decision making, but they're more of a partner, and that definitely challenges the way that the expectations that people have from a doctor, and also the expectations that they have in how the conversation should be unfolding. Social media and any conversation that people have now, mediated either through digital or through their other social networks, really can impact what people believe is are possible solutions to their health, through their health conditions and what they're seeking health for. So the challenge is, there's a bigger expectation, I think, in discussing the health information when people actually get into the doctor's office.
Now, can we put the blame for the erosion of trust all at the feet of the social media companies, or is it bigger than that?
No, absolutely not. I mean, social media have a really big role to play in our lives. I think you've probably heard quite a lot of discussions in. We are definitely caught up in so-called echo chambers or very polarizing information environments through social media. Everyone that is on social media, or even everyone that owns a digital phone, has a very personal experience of the internet, and that also means health information. But and that impacts how the types of information that we receive, how we discuss things, what influences, what kind of information we also react on, and how we make decisions regarding health. But the I mentioned earlier, it's not only about health decisions are not only about information; they're also about our previous experiences with health services. For example, if a young mother had um, not a great experience with clinical professionals at her local health center, she's going to think twice, coming back with her baby for treatment. She might, turn to other people or social media for information on how to help herself or her child or her community, for example. So trust has it's sort of bidirectional. One is for seeking information, and that means that you can trust, information coming from a source or so an institution or a person that you have good experience with, that you feel are, they have your best interest in mind. And as soon as you don't feel that, as soon as people might mistrust the motives, the motivations, the reliability of the person that's speaking with them and offering services and offering advice, that's when we get in trouble. And so this relationality, the feeling of trust is really, really important, and not just in health. I mean, in think about in your everyday life as well.
Yeah. And it goes both ways because you've talked about health providers in the context of, say, doctors and nurses. But in many developing countries, the primary health provider oftentimes is a pharmacist, sometimes licensed, sometimes not. Sometimes they're well educated, but we don't necessarily know their credentials and we don't know whether or not they're certified or whatnot. So they too could be susceptible to misinformation, disinformation, and providing customers with maybe solutions that aren't ideal and maybe influenced by some of the narratives that they see in the media and elsewhere. So the patient sometimes comes to the table with all sorts of information, some of it true, some of it not, but also sometimes it's a problem among providers as well, right?
Absolutely. You're pointing out your really important consideration here. So I work in public health. I work with health professionals of different profiles, not only clinicians. And yes, the uh, perceptions and the beliefs of the health professionals when it comes to different services that they offer or their trust in their own health system, or the products that they're offering makes a huge difference, in how they offer services and how they advise and serve their clients. We see this worldwide, that this is an important topic, probably one of the more studied topics regarding this is vaccine hesitancy, where we've seen that in different parts of the world, for example, in Eastern Europe, healthcare providers are a part of the networks that are spreading misinformation and sowing mistrust in vaccines, for example. But you can see this elsewhere as well, and I always feel it's a little bit of a double-edged conversation to be had here. Whenever someone is, talking about this, the flip side to this as well, what is the health system doing to actually support healthcare providers in their jobs? They have very difficult jobs, and especially when it comes to misinformation, for example, or confusion, they're humans as well. They are impacted both in personal lives and in professional, which means that we do need to support them and have the conversations um, with them just as much as with
Sure.
the communities that we're trying to serve, right?
Now, you spent a lot of time at the World Health Organization, and one of the areas that you worked on was how to combat some of this misinformation. And it seems to me that there's not a one size fits all solution, that different cultures, different communities, different countries will require different modalities in tackling misinformation, disinformation, and outright lies and things like that. Talk to us a little bit about how, when we say maybe vaccine, hesitancy that cropped up a lot during the pandemic in Latin America, but also in the U.S. and also even here in parts of Asia as well. How do you attack that in different cultures using different modalities and methods?
Yeah, I mean, the important thing to think about it here is that really the underlying narrative on the underlying belief, what actually drives people's mistrust or beliefs in a certain narrative, in a certain conversation, right? And culture, which is what you mentioned here, is actually really critical because certain norms, things that we believe are important in our community, they definitely will impact how we react to certain health advice, right? Um, think back to COVID in Asian countries. It was really no brainer to discuss, whether we should wear masks in the public and to protect each other. But this is something that's been normed for a very long time because people have experienced other outbreaks in the past, and they knew that this is how they can protect themselves and others during an outbreak. This was not the case in Europe, for example. I lived in Switzerland at the time. And during the and whenever one would travel locally, also across the border to France, there was massive discussions and objections to wearing masks for all kinds of reasons of, for example, people believing that this was infringing on their personal rights. And that's a big difference culturally. So um, what it comes down to is that when we translate and we try to explain the science and the rationale behind a particular recommendation, it's really important not only to explain the factual, so the reasoning behind the science behind, but also try to also understand the how that will land, how not just to explain to people culturally, but also what kind of beliefs or values the recommendation might challenge, and what can we do to make sure that uh, we can encourage then protective behavior. And this is very special cases during outbreaks. But think about then any health decision that you make, whether go to the gym or you go for a walk or your choices on healthy eating. Those are might sometimes even harder because they are even more culturally colored,
That's right.
and they're colored out of habit as well.
And it also has something to do with how familiar people are with pandemics, for example. So I'm here in Southeast Asia, and over the past 10 years, we've had outbreaks of SARS, of avian flu, and then eventually COVID. So by the time COVID came
Exactly.
along, people were like, okay, I'm ready for a vaccine. I'll put a mask on because I've seen what's happened previously. Whereas in other parts of the world, that were blessed not to have pandemics, this was more of a shock. One of the things that happened during COVID, when we were all kind of locked up inside to some extent or another, is we started turning to the internet, and there were all these people just talking about health. Some of them knew what they were talking about, some weren't. And we saw the real rise of the health influencer. And this has been a topic of interest for you and your research, to kind of sometimes how to leverage the health influencer, but also sometimes they're maybe not as helpful when they're spreading information that isn't validated or isn't proven. Talk to us about the role of health influencer in this whole ecosystem of information.
Yeah. Think back to the COVID times. There is no one health influencer that basically make their brand just talking about COVID-19, right? People that are successful on social media, they develop their brand on a particular image, on particular set of ideas. And for a period of time, COVID, as a health emergency for basically total society event globally, was something that was incorporated into many people's um, feeds. And what we saw during the pandemic is that working with health influencers and wellness influencers was one way of reaching more people very quickly. The challenge is that people that speak on social media, they develop brands that they do this specifically in order to monetize the attention that they get from their followers, which basically means that after a while, it becomes sometimes harder to to make sure that the message that a Ministry of Health or Institute of Public Health wants to send out regarding a particular health recommendation, that's actually going to be compatible with the health influencers, so to say, brand. And so working with health influencers has become uh, one way for health authorities to reach many more people, to spark a conversation about a particular health message. But the difficulty is that wellness industry and the influencers might end up actually developing their brands to sell different products, to promote different recommendations that in the end, long term, might not necessarily be very much reinforcing health. And that means that the challenges, and we've seen this a lot during the pandemic, probably the most reliable group of people that have come online quite significantly have been healthcare providers themselves, healthcare workers, who basically wanted to reach their own patients and other people, answer questions online. But that opens a whole another can of fish, because it opens them also to quite a lot of scrutiny, harassment, etc. So it's an important part of, and influencers are an important part of the information ecosystem, but it's extremely complicated from the point of view of who to trust and what kind of messages are actually reinforced and for what reason.
And of course, some health influencers are coming at it not just for money, but also maybe from a religious point of view, or also
Absolutely.
from an ideological or political viewpoint as well. Health and politics, health and religion overlap quite a bit. Okay, so we've talked about all the problems. We know that it's very difficult. Everybody who's listening and watching to this is probably saying, okay, tell me something I don't know. I mean, we go out into the world and we see the problems. You are pursuing your PhD at none other than Harvard University. You've been thinking about these issues for a long time. What advice do you have for people who are just, again, trying to get their way through life every day and figuring out what's what? What's your best advice for people how to sort through all of this information chaos that's out there?
I mean, absolutely. I mean, for every one of us, the most important thing I think in our current media environment is to slow down when you're making decisions about your health. So, um, uh, definitely, any health information that you do get through your phone or to your friends, think about it. Think about where it comes from. I know that everyone wants to do their own research. That's actually a good thing, but the most important aspect of that is that you're also critical of the of what kind of sources of health information you look for and how you discuss. It's really important to discuss any health decisions with a clinician and or so that aspect of health decision making is really important as well. We've started, you saw these types of recommendations for what people can do already during COVID. It's just really much more difficult nowadays. With a lot of the polarization in the digital spaces. So if you, for example, don't have access to a doctor, then think about your local community health center or someone else in the community that practices medicine and can provide advice. For example, pregnant people now, speak to their doulas or to midwives,
Yeah.
etc. So that's really important for an individual. Because I'm a public health practitioner, I work, with departments of health, with institutes of public health, thinking deeply about, how we can do better. All the promises that we're making to people, that we're going to provide service, that, health products are safe, that the prevention programs work, etc. So how can we do better? And a lot of that, in public health, we talk a lot about being much more in the community, understanding what people need, offering things and services people need. So, if someone's health is at risk because they're living in precarious housing, we need to address that. If they don't have access to healthy food, we need to figure out, how to create better local food systems. So it's a deeper recommitment to serve our communities. And it's our responsibility as public health professionals to reinforce and to build systems that are responsive, that actually meet people's needs better.
Hmm. Sure. Tina, we close every episode of this program entitled Conversation Changers with the simple question of what part of the conversation about public health and digital health and health information do you want to change? What do you think needs to be changed?
I think it comes down to this. We shouldn't just be talking about, oh, Eric, you really need to trust me. I'm charming and I know how to talk. It's about being self-reflexive and say, what makes me trustworthy? And if you're working in a health system, what actions are we taking that makes me trustworthy? And we should do this in our personal lives as well. So thinking about trustworthiness instead of asking people to trust us is, I think, a key to a deeper listening and hearing each other.
I love that. Well, Tina, thank you so much for your time and your expertise today. This is such an important topic for everybody because we're all, again, muddling our way through this health ecosystem and this health information kind of chaos that's out there. So your insights are absolutely essential and vital. We really appreciate it. Tina Purnat is a Salzburg Global Fellow and a visiting scholar at the University of Memphis School of Public Health and a Doctor of Public Health candidate at Harvard University, one of the leading experts in this field of health information. Tina, thank you so much for your time today.
Thanks, Eric.
That'll do it for this edition of Conversation Changers. We'll put links to some of Tina's writings in the show notes, and we hope that you'll join us for another episode. For everybody at Salzburg Global, I'm Eric Olander. Thank you so much for listening and for watching.
In an age of polarized voices and reinforced views, be part of changing the conversation. Follow us on social media and visit us at salzburgglobal.org.